So for this video, we're going to walk you through a palpation exam for the knee. Now, when we're doing a palpation exam, it's important to recognize that our touch in and of itself may have a therapeutic effect. And so before we even touch the patient, it's helpful just to begin with a bit of observation. We can get a fair amount of information just by looking at the knee, observing what's going on, position, static alignment, things along those lines. So let's start there. First and foremost, as you look at the knee, you should begin to visualize whether or not the patella is situated in a more neutral central location. As the knee is in an extended position, the patella is going to ride more superior, and then as you flex the knee, it's going to go more in an inferior direction. So just to demonstrate that, we'll flex the knee here, and you'll see the patella begins to go down more into kind of that trochlear groove, and then as you relax, it tends to glide more superior. Additionally, you can look at some of these infrapatellar pouches and suprapatellar pouches and observe if there's any increased swelling. If that's the case, it can be very difficult to actually visualize the patella in and of itself and its different poles. From here, you can also visualize static alignment of the leg. If the foot is more rolled outward, so that would be that the hip is in more of an externally rotated position, you may visualize more of that medial compartment of the knee versus a more neutral alignment. Conversely, if it's more in an internally rotated position, you may see some more of that slanting towards the medial side, and you can visualize then more of the lateral compartment. Both of those would indicate that the hip is involved. However, the hip is only one of the pieces that we have to take into consideration. We also have to account for a degree of what's known as tibial torsion. And in these cases, we could visualize the knee in a neutral position. However, further down, as we look into the shank and the foot and ankle, we may still visualize kind of that inward or outward position of the foot and ankle. And so all of that we can get just from an observational analysis. As we then dive in and begin our palpation exam, you want to go about it in a standardized fashion such that you're either working from the more proximal to distal location or from the distal to proximal, from anterior to posterior or from posterior to anterior. Several of the structures that you need to be aware of would include things like the different poles of the patella. Looking at patellar tracking is more active, but during your palpation exam, you can look at patellar mobility. The ability of the patella, if the individual is relaxed, you should be able to glide the patella medial and lateral. You should be able to glide that patella more superior and more inferior. So back and forth, medial, lateral. This is especially helpful for somebody who's dealing with patellofemoral pain syndrome or may have some patellar tracking issues. And then you can also look at degrees of rotation with the patella